for January 11th, 2021. Thank you all for joining us. I have a couple of changes to the agenda. Kathy, do we have any comments from the public?
No, Martha, we don't.
Okay, thank you. To change for the agenda, first, we are asked to appoint Leslyn McBean Claiborne to WDIC for a term ending December 31st, 2023. Hi, Dave. Welcome. So if I can ask for a vote to put that on the agenda, we'll do that after the minutes. Deborah moves. Shauna seconds. All right, to vote to add Leslyn's appointment to WDIC. Deborah?
Yes.
Shauna?
Yes.
Mike?
Yes.
And Dave?
Yes.
I am a yes, so that's added after the minutes. And we will not be having an executive session today. We to talk about direct reports. So glad you're happy, Mike.
I am.
Well, we've already set this up to meet with Kathy on Friday at noon. And Sean is setting up a Zoom link for us. I will send that out with a note to everybody tonight or tomorrow. We also, I think, would like to reserve the last part of that meeting. Kathy would hang up and then we would go ahead and talk about our other evaluation, which is Jonathan Wood on Friday. So I've sent out a draft. Now I'm kind of going through my whole report here, but I sent out a draft this morning for that narrative, and so we can talk about that on Friday. So are there any questions on any of that? Okay, all right. So I don't see, if county administrator, I don't see Jason. Am I missing? Lisa, are you gonna be county administrator?
Yeah, seeing that I'm stepping into my deputy role back today. I do know Jason had to step away on a COVID-related matter. He didn't have much of a report except to say that we were in interest arbitration with Road Patrol last Thursday, the 7th. He was the witness for he provided testimony on the county side in terms of the county's fiscal situation. And that went all day. It did not conclude, and we're going to be meeting again on February 23rd to conclude it.
I mean, the testimony wasn't concluded?
His testimony was concluded. They began a cross-examination, which was not concluded.
Okay, and then just to update us on the process then, how the adjudicator, the mediator would make a decision. How does that work?
Based on the exhibits that were provided on both sides, it's the mediator. There's a panel, there's a mediator, and then there's a panel which includes our labor attorney and the union's labor attorney, and they will be making the decision and award based on what they heard in the exhibits that were submitted.
Okay. Any guesstimate on how long till we would get a decision?
Well, we know that they'll conclude, or the testimony February 23rd, so I would imagine some weeks after that.
Okay. All right. Anything else from county administration?
Not that I'm aware of.
All right. Any questions for Lisa, the deputy county administrator? All right. We'll get to that part of the meeting in a few minutes. All right. Thank you very much, Lisa.
Wait a minute.
No, Mike's got a question.
Oh, I'm sorry, Mike. Yeah, go ahead.
I just wanted to say, Lisa, maybe you know more about it than I do, but these press releases about 1B on the COVID thing that have been out. People over 75 need a telephone number to call, not a link on a computer. The one that came out last night, I've already had calls at my office wanting to know what the telephone number is, and I had one person call into the to one of the numbers, and they said you can only register online. So I don't think that's a great idea.
Yeah, I hear you. I will share that feedback.
Thank you.
Yeah, I'll share the feedback and see what we can do to help facilitate for our older adults.
Shauna?
Yeah, Mike, I think I received four phone calls over the weekend, same grievance. So we're definitely hearing it as the representatives.
Mm-hmm. Yeah, and Dave, did you have your hand up?
Yeah, I also got a call this morning. The person was saying that he got on the website, but said it was full and it wouldn't give him the form to fill out. The thing really should be set up maybe so that you can fill the form out and then they'll get back to you when they have an opening. It's kind of like backwards almost. So anyway, that's my 2 cents.
Yeah, there's already been quite a bit of email traffic, and Dominic's messages have sounded like, well, when we have more information from the state, we'll send out another release. I actually would kind of encourage sooner than that. There's a lot of confusion based on the press release that was already sent out, and that's why we're getting so many messages. And I would urge that, like, a clarifying message please be sent out as soon as possible with a phone number, as you said, as was said. And I think to make it clear that, you know, if there's no ability for people to sign up before you have the vaccine and before you actually schedule a clinic, then make it clear, you know, because it's a really confusing message that went out, and I think we can do better, even with the lack of information from New York State, and you can kind of admit that we don't know anything, we don't know everything, and this is why there's a delay. I mean, it's better to share that than what's out there right now.
Okay.
Thanks so much, Lisa. Deborah.
Well, I think if we could set it up as Dave suggested, it would calm people down.
Mm-hmm.
For some reason, they just feel like if they can't sign up today, they just can't sign up.
Yeah.
As if they had the reassurance that we'd get back to them as soon as it was available, I don't think we would be getting as many phone calls and messages as we are.
So while we're on the topic, I sent out a note a few minutes ago about residency, and Shauna had a question about this too. What's the policy when we, you know, if somebody wants to bring their parents in from somewhere else, they're over 75, they want to bring their parents in, or are we actually trying to vaccinate the people who live in Tompkins County? I understand that every vaccination is another step towards herd immunity and all that, and to keeping somebody safe. But I worry that if people can jump the line because they've got connections of some sort, even if it's just, you know I can get my mother in here because I know that we're vaccinating in Tompkins County, but they're not vaccinating in Tioga. I want us to be reaching out to the residents of Tompkins County and making sure they have, I'll say, first dibs. How do we make that decision? Or what is there, does the state tell us we just take whoever comes, or are we allowed to set up a residency requirement?
To be honest, I'm taking down your questions and I'm not fully briefed in this area. So I would hate to say without knowing fully. So I'm just taking down your comments and we'll get them up to the EOC for clarification, try to get back to you. I honestly don't know.
And we understand the state's changing it every
Yeah.
we understand that. That on the State of the State speech this morning, the governor said, "We will schedule appointments weeks into the future." I think that's
Just not this week.
right. And it was like, we
Don't call
want
us.
yeah, we want to have people waiting for the vaccine rather than vaccine waiting for the people, which makes sense, but it doesn't seem that there's a way to do that. So, all right, thanks
Yeah.
for the message, Lisa.
Oh, sure.
Appreciate it. Annie, did you have any questions? You can certainly raise your hand too if you have any questions. And Rich, I see Rich is on the call. All right. All right. Well, thank you very much. Appreciate the report, Lisa.
Sure thing.
Snyder, welcome. How are you? Rick? Are you? Okay, there we go. Do you have a report for us, Rick?
Just on the audits, we started the IDA audit and preparing for them to come in first. We are also preparing the Tompkins task audit. So those are smaller ones that we bite off first. We're in the middle of both of those. Of course, the other ones will be hanging right behind them. So we're fully geared up now for audit mode. And the only thing I wanted to ask of the budget committee, even though the committee schedule isn't set for this year, I do have a formal plan that the auditors and I sign off on that schedules the significant dates throughout the audit. And one of the dates that I need to let the budget committee know about is that we're scheduled for the budget committee meeting in July for a review of the audit. And I know you probably don't have that date just yet because we don't know the committee schedule, but right now it's set for the July 13th budget committee date, and that will have to be changed once we hear when the budget committee actually meets. If it's late in the month, that may be fine. If it's earlier than that, we may have to push it back to the next month, but that's the only thing I have to fine tune at this point because we do have a fairly fixed audit calendar as we work through all the different milestones. So we'll talk more about that over the ensuing months and look forward to bringing that financial report to you in July at your July meeting. And that's all I have for today.
Thank you very much, Rick. Any questions? Well, you just got me thinking about July, Rick. July sounds really great. Whatever's happening, I'm sure it'll be good. Okay, Deborah.
Will we be having one of those meetings like we had this last year with Insero where they go through the whole audit thing?
Yeah, if it works okay with and I'll let this decision be made later by whoever's chair of the committee, et cetera, is that in the last couple of years, we've used the whole budget committee as the audit committee. In past years, going back 4 or 5 years ago, there was a smaller group that was a select group of members from the budget committee that met and sat through the whole auditor's presentation. But it's worked fairly nicely, I think, the last few years where you all, as budget committee members, were invited to that meeting, and those, most of you did come, and it was very fruitful. So I think we'll probably keep it that way, but I always let that remain to be a question that's answered by the chair once we get into our committee schedules for next year.
Thank you.
You're welcome.
I think that works well. So
Yeah.
I just suggest that. Anything else for Rick? All right, thanks very much, Rick.
You're welcome.
Good to see you.
Good to see you.
Workforce Diversity and Inclusion Committee. Annie, are you there now? Ann Corman?
Yes, thank you. So we haven't met in over a month since before this committee met last time, but because of the holidays, we had an extended break between our meetings. But next meeting is going to be, I think, the 25th. I'll look it up while we're talking. I'll try if I can do 2 things at once. But so next meeting, we're going to work on a review. So it might be really interesting if people want to tune in or watch the recording. We're going to talk about the history of WDIC going back, I think, at least 16 years. So I think it would be good to capture that for posterity, and then to help figure out where we want to go from there. So that's going to be the main focus.
That sounds good. That'll be very interesting. Thank you very much, Annie. Mike Lane.
Hi, Ann. Are you, I mean, there was some discussion from the leadership about the possibility of limiting your meetings to every other month. Are you having trouble with work, not having work to do? I'm wondering what's happening there.
No, I think when I talked with Leslin about this made sense to me, just in the respect of looking at COVID, and I've always been a proponent of like focusing on what we need to focus on with the pandemic still raging, and trying to get, as people talked about earlier in this meeting, trying to figure out how to get folks vaccinated and still keep people safe. And then looking at some other things to address over at least the next 6 months. I'm okay giving us, the legislature, staff, and time to figure out what those priorities are and figuring out what to do. So a lot of times what we're doing is reports and summaries from other things that are going on. So I'm okay of taking a little break, and if we have to do more things, you know, via emails, I'm okay with that.
Okay,
I will just comment real quick. I don't, if I could ask Martha this, was there a values team meeting today?
Yeah, I didn't, but first, before we go there, Mike, did you have something else you wanted to say?
well, finish that, then I'll mention.
Okay, I know there's been email issues. I never got that. I only saw Martha's email today. I even just went back and checked. I did not
Yeah.
receive an email for that meeting, and I'm really sorry to have missed that.
Yeah, I was in the meeting and I hadn't gotten the agenda and the backup materials either.
I got nothing about, I mean, I got something that we were going to schedule something, and I was looking for that email, but I never got it.
Yeah, and then Jason forwarded it this morning, like in the middle of the meeting, and I saw my name was on the original message, but it was nowhere in my inbox. It just like, I searched junk and clutter and all the rest. So I don't know what's going on. If it's, I know Leslin has had some email problems too. So.
Especially for meetings like that aren't on our schedule, and, you know, an extra email a few days before to remind folks of it, and then maybe that would have gone through, but I just had nothing about this.
Yeah, sorry you didn't get that. We did a little, I'll just to fill people in, there's been discussion about writing up the values for, sort of identifying very clear statement of values for the county. Staff had been working on that through, I guess, was it through JEDI? Not sure. And then there was a specific values team. Annie and I and Leslin joined it for the first conversation in December. And the what's been boiled down is a set of 4. Let me see how fast I can find it. Basically 4 statements, core values that would be, all right, one sec. That would be, and we're going to be talking about it, integrity, accountability, equity, and respect. And then there's kind of a statement on each of those words. And the issue was, if we're trying to evaluate, you know, in performance evaluations and in creating an inclusive community, how do we really want to state what our values are? So those are kind of the 4 bullet points. Integrity, what did I just say? Integrity,
Accountability, equity, and respect.
Thank you. All right, we'll have a quiz later. So they're going to be sending that around to all legislators, they're going to be drafting a statement about it and a resolution to accept these as our values. It'll come through Budget, Capital, and Personnel, GO, but first to WDIC. So Annie, you'll get the memo as soon as anybody else does, probably before. So that's what happened this morning. Sorry that you missed it.
Thank you. Well, we just have weird things going on with the email, I guess.
Yeah, it happened to me too. So, all right. Anything else for WDIC?
If I could just mention, Ann, I thought the idea of your taking a pause to look at some of the things that you want to work on is probably a great idea. After what we've seen the last few weeks, going back to election, we realize how isolated we are here in Tompkins County. And I hope that WDIC will have some time to start thinking about how we make overtures to try to work well with what seems to be people who don't necessarily agree with everything we talk about. And yet we need them to be a part of a working relationship, whether it's county to county or municipality to municipality, whether it's person to person. I think that that's part of inclusion, and I hope that you can think about that.
I concur. I know Ken at the Human Rights Office, Dr. Clark, has been working on that quite a bit and will continue, but I agree that needs to be a WDIC and countywide focus.
Thanks.
Thanks, Mike. Thanks very much, Annie. Just one other comment under my report. I just want to thank everybody for being active and involved members of the Budget, Capital, and Personnel Committee this year. It's, I think, been a good committee. We've had to handle a lot of stuff, a lot of things thrown, I was going to say tossed, but I'll say thrown at us, often on very short notice. And I think that the committee really rose to the challenge on debating some really tough issues, reading lots and lots of extra material, more than this committee usually handles, and I think making a lot of important decisions that would help the county get through 2020 and get us in better shape for 2021. So I really want to thank each of you and thank all the staff, of course, and Lisa, share with Jason, and thanks for pulling us into these important decisions that we made on things like furloughs, the retirement plan, revising our retiree health care system, all the kind of mid-year cuts we had to make. And then, of course, the hundreds of decisions that went into our 2021 budget. I think it was testament to a lot of careful, thoughtful decision-making. And Mike, to your point about talking to people who don't necessarily agree with everything, I think what's marked this legislature for many years has been almost unanimous approval of our budgets. In fact, in the last number of years, they've been unanimously approved, even when we've had disagreements over particular items. So I think it shows that folks really do have an ethos of pulling together and making the most common sense, prudent decisions for the whole community. And it's been a pleasure to work with everybody on this. This is where usually, like at the end of a committee chair tenure, you kind of give people some candy or something like that, you little presents. Sorry, sorry, I'm like, can't.
It's not in the mail?
It's not in the mail. Sorry about that.
Martha, thank you for chairing us this year. Not been an easy year.
My pleasure. Happy to do it. So the next topic is also is fun. This is where we're really looking ahead. Some of the decisions that were made this year we're about to really kind of implement them. So Lisa, you want to take over for the last time as the Human Resources Commissioner's report?
Yeah, I'd love to.
Okay.
And so excited to introduce both Ruby Pulliam and Larry Workman. And I hope that they both can get their cameras work. Oh, awesome.
There.
Awesome. Yay. Great. So let me start with Larry, who's been with us a little bit longer. He started back, was it December 14th, I think, was his first day in Human Resources. He's our new recruitment administrator in Human Resources. He comes with many years of experience, having worked with challenge industries for a long time and strong roots in Tompkins County. And what was nice was that when Larry interviewed for his position, Ruby, though she hadn't begun with us yet, was able to participate in those interviews and help with the selection and hiring process of Larry, who she will be working with. And then I'll just do the broad introductions and then let them speak and let you answer questions. And then Ruby just began with us this morning. We have had a whirlwind of a day, and I don't know about her, but I'm exhausted. She moved here from Niagara Falls just this past week and began with us and had her new employee orientation this morning. And brings with her many, many years of great HR experience. I know Martha and some others of you may have been on the interview committee. So I'm very glad to be introducing them both and can't wait to work with them now and in the future.
Welcome, Ruby. Welcome, Larry. I'm not welcome, Larry, but this is the first opportunity we're getting to meet you. Ruby, so you really did move? You're not just on, Zoom from Niagara Falls?
Oh no, I'm in all the way.
Good.
Both feet are in.
That's wonderful. Well, welcome. And we hope that it's just the beginning of a very, very, very long, friendship and alliance here. And Larry, it's great to see you and to know that you've had a lot of experience in the community. That's excellent. Ruby, you want to go ahead and say a few words? Please, the floor is yours.
Okay, well, first I'd like to thank all of you for your support during the interview process. I'm glad to be here, and I'm looking forward to working with each of you to accomplish the goals of the department, the diversity, human resources. I'm just looking forward to working with you all. It's been a pleasure, even though it's been exhausting today. It's been very nice, and I feel welcome. I feel like I'm a part of the family already. I've come here from 10 years or so from Niagara Falls as the Director of Personnel there, in charge of Civil Service, Human Resources, and EEO, Equity and Diversity. Before that, I was Equity and Diversity at Buffalo State College. So I'm looking to just bridge all of my experience together into this one position. So I may need help keeping myself off from going off on a tangent, but the good thing about this position is I feel that it encompasses all of the experiences I've had and give me an opportunity to do even more so. And I'm looking forward to it.
That's wonderful. And thank you so much. Larry, you want to take a few minutes?
Certainly. It's very nice to meet you all, even though it's this way, but it is what this is. And yeah, I'm really excited to be here and start recruiting for Tompkins County. I was at Challenge for 17 years and was the director of their contract staffing business. And working for a not-for-profit, you get to do it all. So recruiting fell on me, HR, it is the nature of it, trainings, everything, which was great. I loved every bit of it. I have hired, I couldn't even tell you. Well, we went from a staff of 45 people when I started in contract staffing to 150. So I have had a lot of interactions with people in this community over the years. Hiring all different levels, being involved from hiring CFOs to executive directors to counselors to frontline folks. So quite a variety of hiring and recruiting. And definitely the piece of working there, diversity of our workforce was massive, very rewarding. Taught me a lot over the years that I was there, and I hope to bring that knowledge and share it with not only folks I'm recruiting, but work on the retention part also with department heads and other staff and managers to kind of teach them what I've learned in that same role for so many years.
Sounds terrific. I mean, that's a lot of experience, and we will certainly be leaning on that. So, committee members, any questions?
Welcome.
Thank you.
I also would just
Glad
throw
to see
in,
our office staffed up again. That's wonderful.
yes,
I bet Lisa's glad too.
Yeah.
yeah, you said it. And while it's not our role, the human resource in the county's role to recruit for the library position, the executive director of the library, they have been, Larry has been helping with some of their posting and helping with their search committee and kind of consulting with them over the last week or so. So that's one thing that he's been working on, and has been assisting with some of the health department recruitment that has been happening with the nurses, project assistants, and will be shortly swinging into gear with some of our department head searches.
Excellent. I know a few of us are anxiously awaiting for the recruitment for the chief sustainability officer and the housing person in the planning department and the business energy advisor person. So
Yeah, you guys won't get bored, that's for sure.
we're going to watch those for sure. Yeah, that's good. And I want to say, you know, when Lisa stepped in to take things on as interim, I'm sure she didn't expect it to last this long. And I know she didn't expect to have to deal with a pandemic. Like,
Nobody did.
no, so it was, Lisa, this was really yeoman's work, and this last, 18 months or so, you know, has really been essential for our departments, for our staff at all levels. And so many times I know we would trade messages like, Lisa, I'm there and you're handling this. Things that really needed digging into the details and the law and the finances, but also being able to really, you know, kind of hold somebody's hand when you had to say, look, your job is going to have to change. And we hate to be putting you in this situation, but somebody who could handle all those different aspects. Lisa, it's been a real pleasure to know that we could count on you for that. And thank you from all of us.
Thank you very much. I have to say how exciting it is for me to have spent this short time with Ruby today, and she's asking all the questions like very incisively that I didn't know enough to ask. You know what I mean? The handoff is going to be a pleasure.
Wonderful. That's
Right.
good. Mike Lane.
I just wanted to ask quickly, what's the timeline for the appointment of the library director?
Maybe Larry
knows.
So they want the ads to run through the 31st of this month. And then they're going to start an interview process running into March and then make a selection. They said they're hoping by May.
By May?
Oh, yes.
Thank you.
All right. Committee members, anything else? Ruby or Larry, any questions for us? Well, don't hesitate to ask when you do. I won't say if, but when you do. All right. Thank you so very much.
Thank you.
It's wonderful to see you. How did
Thanks,
the
everyone.
budget go, by the way, Ruby? You were sticking around for that, right?
Oh, it was a rough road. Yes, but it was completed. Niagara Falls is in a bit of a pickle right now, but they're going to make it through.
All right, thank you.
Thank you.
So to go to our packet, we have an information item, packet page 3, and also page 5, some budget adjustments. And I had asked Lisa about, especially about this first one, about the recruitment money. You want to share what you shared with me, Lisa?
Sure. So we knew in 2020 that we were going to overexpend our a budgeted amount for the recruitment efforts that we were doing. And we went back and looked at the titles for which we used, paid recruitment funds. And we had a number of them, and they weren't all just department heads. They were other, titles in the organizations that were important and or difficult to recruit for. So we had the communications director, chief equity diversity officer, human resources commissioner, mental health deputy director, mental health clinic director, and I think we advertised for both of those at least twice because we didn't find candidates the first round. Psychiatrist, and I think actually we bundled all 3 of those for mental health. Community mental health nurse, community health nurse, and the recruitment administrator. So we did a lot of recruiting and hiring in 2020.
All right, thank you very much for sharing that additional information. Any questions for Lisa on either of these? All right, thank you, Lisa, appreciate that. There's no vote on that, so we can move into our resolution, packet page 7. Somebody want to move this one? Read the title, Shauna?
Yes, I would like to move Resolution ID 9824, authorize county administrator to execute contract with Cayuga Health Systems for the continuation of community surveillance testing for Tompkins County residents related to COVID-19.
I'll second it.
Second by Deborah. Discussion. I had one question, two language issues related to the same question. Line 23, it says that that today CHS has tested over 650,000 individuals. So that sounded high. I went to the website and as of last night, the tests we had done was under 600,000, 589 or something. And I remember we had a lot of discussion about this some months ago, that those are not individuals, those are tests, because an individual, once you're tested positive, you'll end up having multiple tests. So could we change this? I was wondering if it would be more accurate to say, today CHS has conducted almost 600,000 tests instead of has tested over 650,000 individuals. Does that sound accurate, Lisa?
Yeah, I think that's probably the more accurate figure.
Okay, Kathy, did you, or Michelle, did you get that? Conducted almost 600,000 tests, and that takes us to line 39 as well, 38 and 39. Over 11,000 Tompkins County residents have been tested. I think this should say tests have been conducted for over 11,000 county residents. Is that correct, Lisa? It's not that, or I guess it's, this is the same sort of thing. It's 11,000. Well, now that's confusing. Now I'm confusing myself, because if we've done 600,000 tests,
Yeah, but remember that there are tests that are paid for by FEMA. There are tests that are paid for by insurance. There are medically necessary tests. The only tests that our program pays for are the county residents that don't fall in those categories.
Okay, so Lisa, is that are we saying this part correctly then? Is that 11,000 is the right number who are in that category in the free surveillance?
I'm gonna have to double check and get back to you. I'm looking into it right now. Let's see.
Martha, I think my question is, are we talking like 11,000 residents, or because 11,000 residents can take multiple tests,
Right.
right? Or are we talking 11,000 tests? Because they're two very different things, right?
Right. And I know the 600,000 is the number of tests, but so Lisa, if you can check on that, we can certainly, if we have to make an adjustment when it goes to the full legislature, we can.
And yeah, so I can ping Dominic and Amy right now. Actually, since we're on this topic, going back to some of your previous comments about vaccinations, I shared them and I heard back from Dominic that they are working on all of what you stated in terms of the call number for the 75 and over. He said the call center hopefully will be up sooner rather than later, and they're hoping that Cayuga Health Systems will take it on. The item about the residency requirement is it's state policy that there is no residency requirement between counties. So, but I will, and I can clarify these questions about the kind of unduplicated number of people versus the number of tests.
Okay. Thank you. Because even it did seem like even if that you could end up with free, under the free testing program, you could end up with multiple tests per person.
Yeah.
Okay. All
In a
right.
pinch, we could just say thousands of county residents have been vaccinated, or tested rather.
Okay.
All right. Thanks very much, Lisa. Anything else on this? A small thing on line 2 on the next page. The clause didn't quite make sense. The recommendation of the public health director, county administrator, and director of finance is for the Tompkins County Legislature to authorize another $300,000. I think it doesn't, there's something missing there. So I put, so the recommendation is for the legislature to authorize. I think makes more sense. Got that, Kathy?
Yes, I do.
Great, okay. All right, anything else on this? I'm really glad we are in a position to do this, and you know, I think it's really been very important and made a lot of difference for our community. So thanks to everybody for bringing it forward for another bucket of money. All right, ready to vote? Mike Lane? Good, Mike.
Yes.
Dave?
Yes.
Deborah?
Yes.
Shauna?
Yes.
And I'm a yes, so that's unanimous. Thank you very much. We have next one is a budget transfer from contingent. Somebody want to move that one?
I'll move that one.
Okay.
2021 budget transfer from contingent fund to county administration for community outreach worker program ID 9807.
Okay.
I'll second it.
Second by Dave. Thank you very much. Any questions or discussion? All right, I'm ready to vote. Mike?
Yes.
Dave?
Yes.
Deborah?
Yes.
Shauna?
Yes.
And I am a yes. All right, thank you. We have our minutes from December 14th.
I'll move them.
Dave moves the minutes. Somebody second? Deborah seconds. Any discussion or corrections? All right, let's take a vote. Deborah,
Yes.
Mike,
Yes.
Dave,
Yes,
and Shauna.
Yes.
I'm a yes, that's unanimous. Somebody want to move Leslin to the WDIC committee? Shauna nominates Deborah, and Shauna nominates Leslin. Mike seconds for Leslin to be on WDIC for a 3-year term. Discussion?
I don't know. She's pretty shady.
Yeah, I don't know. Let her do it. All
Does
right,
she know anything about that committee?
I don't know. Annie will teach her, right?
Yeah.
Okay. All right, let's take a vote. Dave,
yes,
Shauna,
Yes.
Deborah,
Yes.
and Mike.
Yes.
All right, I'm a yes, that's unanimous. So that is our business for the, I guess, year. I did talk to Deborah a little bit today. There's a draft committee list out, and I won't have to. I think we can talk about it. We can all talk about it might be on the agenda for next year's budget committee or for the 2021 budget committee. We had previously talked about reviewing the rollover policy, and I had hoped we would be able to talk at this meeting about our workforce demographics. Where are we with workforce diversity? How well are we actually doing in recruiting and retaining diverse workforce? Staff has said that they weren't quite ready for that, but we are going to have a smaller meeting, Annie and I, and I guess Lisa and Leslin and Jason and Ruby to talk about this, to sort of what's the context, what are the questions that we want to ask. So that is going to move forward, but it's not quite ready for the committee yet or for WDIC. So that will happen. And I hope next year's, for the 2021 committee would take that on. And I would hope also that we take a look at rollover too. So just a couple updates on those items. Mike?
Just I'm wondering about how this year, maybe Shauna knows, or maybe Kathy, or you've talked about it. How are we going to determine the committee meeting dates and things? In the past, we've tried to get together after the first legislature meeting of the new year and kind of went different parts of the room and said, how does this work for you? How are we going to do that this time? Kathy's got her hand up.
I guess my hope was I was going to send out the draft schedule from 2020 and then ask committee chairs to confirm meeting schedules by the end of next week if the committee assignments are final by next Monday.
So we're going to need to basically communicate back to our chair if there's problems, with the chair of the committees, whatever committees they are, and then
it'll be the responsibility.
I remember trying to schedule a couple of things over the past few years that were pretty tough.
Yeah. And, I think that's probably going to have to be the best way to do it, is just have the committee chairs take the responsibility and reach out to the committee members and come up with a meeting schedule.
Okay, I'm game.
There's a fair amount of overlap between this year's BCP committee members and next year's. So I guess it would be good to know if the people here who are on next year's committee would be willing and able to continue to meet at this time on this day.
I think it's premature because you don't know what other committees you're on. That's why it's a real iterative process. At the moment it works, but we don't know what other things are going to change.
Well, yeah, if we nail down our time first, then we're golden, right?
There you go.
One issue for this committee in particular, Kathy has an exquisite sense of the flow of things, that if budget is in the wrong sequence, with other committees, then resolutions, financing resolutions can get stuck waiting an extra 2 weeks or so, right, Kathy?
That's correct.
So that's one of the considerations that other committees don't necessarily need to look at. So, Mike, is your hand still up or again? Or?
No, I'll take it down, but I'm just going to say, especially in August, right?
So I'm curious to hear from Kathy whether it's good for this committee to meet early in the month or late in the month.
It really depends on when the other committees meet, because often if a resolution needs to go through the budget committee, it typically goes through the program committee first. So if the program committees meet prior to when the budget committee meets, and then we have the deadlines for legislature meetings too, you know, for the agendas that have to be taken into consideration as well. So it's.
Kathy has magic that makes it work.
I don't know about that, but.
So everybody stay flexible and we'll figure it out. Lisa, I think I saw your hand about the halfway going up.
Yeah, I'm getting some reconnaissance from Dom and Amy on that resolution and those figures.
Oh, okay.
So it was the testing. It was the testing numbers, 13, and now it's up over 13,000. And that was those were tests administered. And they are Tompkins County residents.
So it's not 13,000 residents, but it's 13,000 tests on county residents.
That's correct.
Okay. All right. So let's see. So if we could say.
So we would want to say they've administered over 13,000 surveillance tests to county residents.
There you go.
So over 13,000 tests have been conducted through the county's free surveillance testing program. Over 13,000, delete Tompkins County residents. 13,000 tests have been conducted through
Surveillance tests. Well, okay.
through the county's free surveillance testing program.
Can I ask a question?
Yeah, sure. Go ahead.
This is Ann. So isn't surveillance testing, say, for instance, you know, hairdressers, where they have to get surveillance testing every couple of weeks? Isn't that what that is?
The issue is, this is very specific of the county's free program.
Right, but somebody could take advantage of that if it's not surveillance. I'm not, I guess maybe I'm not sure what you mean by surveillance. Because there's surveillance testing for people who are in certain jobs.
Surveillance in this instance, correct me if I'm wrong, Lisa, means basically anybody who's getting tested without having three indications: the indication of symptoms, or you had direct contact with a positive case, or you were getting it was a pre-medical, medical procedure, and they asked that you get tested. Those are the three indications under which insurance was paying, if I'm correct.
Right, but somebody could have all of those indications, for instance, and not have insurance.
That's it.
And then we would pay for them.
Yeah, that's right.
So I'm just wondering, surveillance, I don't know if that's the right word, but maybe it is.
Yeah, I think we should leave out surveillance, because I think someone could have symptoms and not have insurance, and we're going to pick up the tab.
If they have symptoms, though, isn't it medically necessary, and doesn't FEMA pay for it? I'm
Right.
Well, you know what, guys? Surveillance is throughout this resolution. It's in the title. My sense is surveillance lets us be as broad as possible, rather than somebody is getting tested for a specific limited reason. For example, back in, I guess, October, I was having some mild symptoms. I didn't call my doctor or anything. I just, have been listening to Frank for 8 months. And so, I was like, in a normal year, I wouldn't have done anything. But this year I got a test. No doctor told me it was medically necessary. I would, Lisa, do you feel surveillance is an appropriate word here? And we've got it throughout this resolution.
I think so. And I think, it's a continuation of what we've been doing where that term has been used, kind of synonymous with, it's an early warning, early indication, to stay on top of things, stay ahead of the curve. So I think that's the context that it's being used.
If I could add, we're using the surveillance term in a broader sense than what I was specifically talking about as far as surveilling specific people in certain jobs. Could we somehow put in a definition or mention what types of surveillance testing, just so that people don't get confused, or we can look at this later in time, even if it's years from now, because if we're not clear, then of course the community might not be clear.
Well, it just continues what we've been doing. I don't think we're not changing anything here. We're just adding new money. Ashana?
Yeah, one thing that we talked about in HHS as well was that if the employer requires you to get tested, then that is not covered. The employer should be picking up the tab for that. If you are an independent hairdresser and you want to go on a weekly basis to make sure that your clients are safe, then that's a different situation because it's not necessarily required, but it's you going for your own peace of mind, in which case the county would pick up the tab if your insurance did not. So, I don't think we have to, really outline this in the resolution here. This is just a vague passing of money from the county to Cuga Health Partners so that they get paid for the testing.
Yeah, and this isn't the policy. This is just a statement. So I think that the criteria have been laid out well, and we've been using them since September. If it's okay, I'd like to leave that part of alone. But just to confirm, Kathy, you have lines 38 and 39.
Yeah, to read, whereas from September 1, 2020 through December 12th, 2020, over 13,000 tests have been conducted through the county's free surveillance testing program.
Perfect, yeah.
And then line 23 is going to read, and today CHS has conducted almost 650,000 tests to individuals in Tompkins County.
Yeah, I think it was 600,000.
Okay.
Has conducted almost 600,000 tests in Tompkins County. Okay, so since we already passed it with the first change, but not the second one, is do you want us to redo this, or should we just say, is it friendly?
It's friendly to me.
And me.
If the committee accepts, that's fine.
Committee accept.
This is a different version that went through health, so these changes will be highlighted on the legislature agenda.
Okay, so and friendly to everybody on the committee?
Yes.
Okay, excellent. All right. Lisa, thanks for getting that information. That's great. Terrific. All right. Anything else for the good of the order? All right. Thank you, everybody. Kathy and Michelle, thank you so much for keeping us on the straight and narrow here and making all of this work. So have a good afternoon, everybody, and we'll see you soon.
Thank you.
Thank you.
Everybody.